Addiction is not a disease, but a choice addicts continue to choose. Most addicts who renounce the high life do so without formal treatment. Treatment studies do not often include these people who have overcome addiction without formal treatment. This underestimates the recovery rate. Addiction is a bad habit that needs to be embraced and not blamed as a disease. Those who successfully recover take responsibility in their addiction rather than placing blame somewhere else. If addiction is a disease, then how come most addictions end spontaneously without treatment? How did 75% of our heroin-addicted Vietnam vets return home and kick the habit alone? When you think of a brain disease, such as depression or schizophrenia, do you think of those people just waking up one morning and saying, I'm not going to have this disease anymore? Providing you with facts today on addiction, I want to clear the stigma that stands behind us placing blame on a disease rather than the addict and the addiction itself. Addiction is defined as a chronic relapse brain disease that is characterized by impulsive drug seeking and use despite its harmful consequences. It is considered a brain disease because the drug changes the brain. It changes the structure and how it works. These changes can be long-lasting and lead to harmful behaviors seen in people who abuse drugs. Let's take a look at one of my favorite clients that opened my eyes up to this issue. It's the first day of rehabilitation, and for confidential reasons, we'll call this 42-year-old client Vicki. Vicki opens up her first group session with her why story. She's here today after going to a doctor's appointment with her mother, who's 60 years old and been having a lot of shoulder pain. Vicki admits the reason she was active in her mother's care is because she knew with her mom's pain and her age that she was a perfect candidate for opiates from the doctor. This was Vicki's opportunity to get her fixed by taking her mother's pills when she could not get her drug of choice, which was heroin. Vicki did not realize how life-changing this appointment would be for her and her mother. The doctor comes in with all of Mom's images, and his face shows concern. In a matter of minutes, Mom, who has some shoulder pain, is told she now has bone cancer and needs to have a full body scan. Vicki recalls the following days being a blur between medical appointments and her using to deal with the pain the way that she knew how. After the body scans, they learned that Mom's cancer was just not in the joint, but it was in several other areas, and she needed invasive chemotherapy treatment to start immediately. Vicki's disease of addiction was not comparable to her mother's disease. Mom did not wake up one morning and decide to have cancer, but yet each day, Vicki woke up making the choice to use. This was the moment she knew she did not have a disease, but a habit that she allowed to control her life. Addiction should not be classified as a disease because any repetitive activity changes the brain's function. Addiction changes the plasticity of the brain, but the way it changes it has to do with the learning and development, but not of the disease. The changes come from addiction are not permanent or dangerous, and they are not abnormal. These are the same changes that happen when becoming a basketball fan, falling in love with somebody, finding a new passion, or even pertaining to your religion. When studies were performed on each part of the brain for desire, emotion, impulse, and automatic behaviors, all of these connected with one single goal, which was consuming an addictive substance. The brain is built to learn and change, but is also made up of formed pathways for repetitive behavior, according to neuroscience Dr. Mark Lewis. A former addict, Dr. Lewis has dedicated his studies in neuroscience to the correct treatment of addiction. Addiction is a habit that we need to realize how deeply it is ingrained in the brain. Like Pavlov's dogs, who salivate at the sound of a bell. Often, users don't want the drug anymore, but they have forgotten how to function any other way. Dr. Lewis has described addicts. They are not diseased. They don't need medical intervention in order to change their lives. What addicts do need is sensitive and intellectual social scaffolding to hold the pieces of their future together while they reach towards it. In a true disease, some part of the body is in a state of malfunction, and this causes undesirable symptoms. Like with cancer, the state would be mutated cells. Diabetes, we point to low insulin production. Anyone who has these types of diseases cannot directly choose to stop their symptoms. They can only choose to stop symptoms indirectly with medication. Whenever we practice doing or thinking enough, the brain changes. Different regions and neural pathways grow and strengthen. Some areas become more or less active depending on how much you use them. This is a process that happens during life, and there's nothing that's abnormal about it. These changes are not irreversible, and the brain will keep changing throughout your lifetime, whether due to your behavior, a result of practicing a hobby, or even your environment. Addiction is a habit that grows by itself and can become a large issue quickly when in repeated use. How does addiction grow in the brain, you may ask? Addiction grows your brain. As addiction grows, your brain makes millions of new connections. All these new connections make a new path for thinking and feeling. This is what strengthens the belief that taking a drug will make you feel better, even knowing the end result. These addiction habits are learned more quickly and deeply, which leads them to taking over day-to-day life. Addicts lose interest in playing with animals and even raising their own children. Addiction in research has been compared to romantic lovers. When you fall in love and have that connection with a person, a certain area of your brain is used more than others, just like using an abusive substance. Now compare this to ending a relationship. Your brain is programmed to love one certain person. The ruts of loving them lie deeply in your brain. But when somebody new comes along after a breakup, you have a wall and you block your emotions. Shortly after, you find yourself able to say, "This wall is enough." And with effort, you remap your brain and begin to have feelings for someone else. These old ruts are still deep in your brain, just like addiction, but with proper positive treatment on your thoughts and lifestyle, you can change, just like you do after a breakup. A specific area of the brain, the hippocampus, is associated with creating directional memories and a mental map of your environment. A team of researchers scanned the brains of London taxi drivers and compared their brains to non-taxi drivers. There are very noticeable differences, not only between the drivers and non-drivers, but also between the more experienced and less experienced drivers. According to the study, the longer you drive cab in London, the more your brain physically changes. The longer we use drugs, the more our brain physically changes. So, if we follow the logic of the NIDA, then London taxi drivers have a disease. Can you call it taxism? That forces them to drive taxis. This is why the 200-year-old disease model we base addiction off being a disease is out to date with current technology. Slide, please. New studies, as the one I spoke about above regarding taxi drivers, show the brain changes with any repeated behavior. So you go to the gym, your brain changes from one change that you're making to your body. Does that make it a disease also? Allowing addiction to be classified as a disease, we are helping users relive their guilt, shame, and blame on something rather than their own willpower being able to change their brain back. Knowing that treatment is not required by most to overcome addiction shows that in a sense, it is not a disease. Dr. Mark Lewis talks about his most recent interview, Why Addiction is Not a Disease. Addiction patterns are referred to as what is called deep learning. The habit is learned more deeply and locked in more tightly. If we take away the disease and addiction and the 12-step programs, we can empower addicts and that they are able to cure themselves rather than placing a blame on a disease or power in a higher power to be able to save them and heal them from the choices that they have made. You do not need treatment to quit the cycle of drug abuse, rather than self-empowerment that can make the change and with help of friends and family. You need to be able to look back on your past and forgive yourself for your actions. Here you'll see the slide that represents the brain scan of a meth addict along the brain scan of a non-user. We're told that the decreased activity in the brain, which is the red area that you see on the left and you don't see any in the center, is because of the compulsive use of meth. When the drug stops, the center one is 1 month of abstinence, and the last one is 14 months. You see the red areas start to grow, so therefore the brain activity is coming back. Same thing after cocaine addiction. No drug use on the left. The center is 10 days without cocaine, and the last one is 100 days without cocaine. Unlike any other disease not medically treated, the gray matter begins to grow once again once you stop your drug use. Diseases such as cancer, MS, kidney disease, and diabetes do not just go away with change of habit, but with medical treatment they can be controlled. If exercise has changed the plasticity of your brain, like any reoccurring habit, does that make it a disease too? 20 minutes of exercise a day can make the same changes to your brain that addiction and recovery does. Positive use of your brain promotes growth of gray area, no matter what your age is. This is an image of what meditation does and the different areas that it promotes growth. Only you can make the change. The top one, you have a normal brain, different layers of it. That way you can see the different parts that start to occur. Gray matter. And then you have your cocaine abuser that is 10 days clean. And then you have your cocaine abuser that is 100 days.